Now I would like to open the session for the question and answer. Is there any question?
I started off not being a medical doctor. I started off not being a BOMO. I started off not being a Chinese herbalist. I started off as a scientist with a blank piece of paper, and we work up from there. So I learned myself, really, a lot of things. So actually, I have formulated at least 80 types of formulated tea for different type of cancers. What you need to do is you have to bring me your medical report first. I want to know what is happening with you and what has been done. And based on that, I then somehow or other, I tell people this. I don't know anything much, but I need to only know 50%. If you are honest and sincere, another 50% comes up from God. Therefore, sometimes I cannot explain what I do, but that's good enough. Because just from talking to you and looking at a medical report, I will know roughly what you need. So I will prescribe the herbs accordingly. If you have bone cancer, I'll give you bone. If you have lung, I'll give you lung tea. If you have ovary, I'll give you ovary. If you have cervical, I'll give you cervical. So it is not a size for every cancer. It is different. So I have formulated at least 80 types of different herbs, formulated herbs, using at least 350 types of herbs. Inshallah, the rest. Does that help you? Is that what I'm... Yeah.
Thank you. Chris, thank you very much for your presentation. I have got a question and a comment, and this is completely open-minded, so please don't feel offended or feel that I'm criticizing you. The question is this. You mentioned just now that you want to see the doctor's reports. I want to ask you to elaborate further. How much reliance do you put on these reports? Because it was raised early on by the pathologist. I mean, personally, when I practice as an oncologist, I don't rely on the pathologist's report. I want to see the slide with the pathologist and ask him why he calls this is cancer, this is this type of cancer. So there's a certain standard we have to adopt to diagnose a cancer. So I want to ask you, ask the question before I comment, how much do you rely on the pathology or the doctor's report? Because personally, I will not believe my colleagues.
Yes, I do respect. We have to play the game according to the rule. I have to respect what the doctors say. I'm a one-man operation. I can't run. I'm going to run a hospital, work. So what I need is that at least I want the guidance from the doctors. So I'm not too bothered about whether it is grade 1 or grade 2 or whether stage 1 or stage 2, but I'm more interested in looking at a CT scan. So I request, I'm not a radiologist, so I don't know too much about CT scan, but I know enough to understand what I'm doing. So I look at this CT scan, I look at the report, and let me just tell you, I have seen enough mistakes in the medical report itself. I have seen enough mistakes that doctors give the wrong prescription, doctors just say the wrong thing. If I were to turn this up, I think they got sued. How can, when you have certain things so high and it is nothing in there? So yes, I'm aware. And I've got 3 years of medical report, the same mistake being committed all the time. I say, apa ni? You need a scientist possibly to understand that, but anyway, that's it. So as much as I say, I doubt, I have to respect what the doctors say, because I can't question and say, hey, this and I'm aware. I really respect the unknown hand, but they are the greatest guy. These are the one who interpret the slide, whether it's cancerous or not. I've seen enough. They took out the breast. It was the wrong breast. It was the wrong thing. Yes, we know that. So yes, we know that. So sure, I need as much help in terms of medical report, but I'm also sensible. But I cannot do otherwise. Okay?
Okay, I just want to give a comment about your first case you presented on neuroblastoma. A child with neuroblastoma and become all right with herbal treatment. Yeah. And in medical literature, it's known that neuroblastoma can have spontaneous regression. This is very known fact. Even without treatment also it can regress. And it is of course some percentage, maybe this case is just spontaneous regression rather than any horrible. This is my first comment. And second comment is that few of the practices we just saw actually is highlighting the principle of integrative oncology, what we mean for the seminar. So like taking herbal treatment during cancer, chemotherapy or like treatment. So I don't think it falls between the purview of integrative oncology. I just want to comment from our oncology colleagues as well.
Fair enough. Nothing is perfect. Whatever you do, whether it's radiology, whether it is surgery, whether it is chemotherapy, if you want to punch hole, we can always punch holes. One thing I would like to tell you this, at least sitting down there listening to many things, I think it is a good idea that at least you say what you want to say, then at least allow me to say a few things that I want to say. At least we are beginning to consult each other rather than insulting each other. I think this is beginning. So organize some more like this, invite me more, and this time give me more time. I'm going to show you more video clips. And then you can punch hole as much as you like. It's okay with me. You know, you can say this to me, spontaneous healing. You can say this placebo. This is a good thing that, you know, same story that is repeated by, you know, like a tape recorder. That's okay with me. I don't get felt insulted. If you think it's placebo, placebo. You know, a lot of people who come and see me, walk in to see me, oh, I akan mati dah, mati. After talking to me, when they get out of my center, you know what they said? I'm 50% cured. The confidence. One VIP came to see me and said this. I came to see Christian. I was in terrible shape, panic shape. After I talked to him for 2 hours, the fear of death all disappeared. I feel so good about it. You know that? So be it. The whole idea is we want to help patients. We are not interested whether my herbal medicine is better than your medical or your medical is better than mine. Let's forget about it. Love and compassion. That's the reason why I do not charge you any money to talk to me. Compassion for each other. Okay. Because I am retired. I don't advise young men not to charge. But for me, I'm already retired, so I'm okay.
The comment on, I wasn't given a chance. Now, Chris, I would just make a suggestion. So don't be offended. Again, I just want to be very diplomatic. How sure are you that you have come, in your case, in the last case where you presented the man with the colorectal metastasis, how sure are you that you have not received the benefits of you coming in to consult when the person had been getting his optimal benefit from the chemotherapy? He could have well received some irinotecan-based treatment or xaloplatin-based treatment for his metastatic colon cancer, which is a standard of care at this time.
Yes, the message is simple. No one discipline has the monopoly of saying I can cure cancer. There are all exceptions to everything. So I go do my job, I'm happy, and I'm satisfied, and I'm, with God's blessing, thank you very much, I said to everybody. But you can do yours, and we will help again. Like I got patient who did not do any operation and still survive today. You may say what you like, but more important to me, you know, the one who took care of my Mercedes, I took care of the mother. No operation, colon cancer. She cried like anything. You know, yes, after 2 years, she died. Died not of cancer, died of old age. When I drove my car to repair the Mercedes, she came in, hold my hand. Thank you very much, she said, for everything. You did something for my mother, and it's great. That is all that we need. Don't you think so? No patients are going to live forever. That is God's work, not us. For as long as I can help, for as long as I can be useful to other people, I think my mission is